Hi, I'm Jennifer Bergeron. I'm an engineering student at Chattanooga State with focus on radiation protection. I've been thinking about the diversification in language in the United States and how it plays a role in health physics. Most likely, a patient's comfort level is correlated to the dialogue that he or she has just prior to radiological imaging or treatment. So in this presentation, I'd like to kick the tires a bit and look at vocabulary as a tool to keep patients from avoiding medical treatment due to fear. We'll begin with an example of a misunderstanding that has recently and locally occurred between a doctor and a patient regarding dose and radiological risk, and then explore ways that we can prevent such miscommunication by the creation of a terminology data bank that's accessible to healthcare providers. We'll go into a way for universities to bolster their science and outreach programs by collecting this data through internships and clinicals. And finally, we'll take a look at the diversification of the many cultures here today in the United States and explore the use of this data bank to create science and literature to more thoroughly address the needs of the public. Everyone has unique experience with language, and this is mine. My radiation protection program is training me to protect predominantly power plant workers from the harmful effects of ionizing radiation. I believe that it would be my job to keep them safe by making sure that I'm allowing them to understand me. I'm also a pancreatic cancer patient currently surviving in the healthcare gap and will need radiological imaging for life. I can't afford to see an oncologist and specialist as frequently as I should, and in many ways, I have to take responsibility for my own self-rescue by my ability to communicate. Before I got sick, I was a genetics cancer research specialist at LSU Medical Sciences Center in New Orleans. English was not the primary language spoken in my laboratory, and I've often observed Colombian scientists and Chinese scientists having to become very, very creative during their collaborations. And finally, my former acting career is not really relevant here except for one experience. And that's when I made a movie in a foreign language, but with a Cuban dialect. And my dialect coach, Senora Anna, refused to A, take any money from me, but B, also refused to train me until I showed her that I had respect for her culture. So she requested that I learn to cook Cuban cuisine. She requested that I took salsa lessons. She requested that I observe some of her patron saint holidays with her. And when she felt comfortable that I gave her the respect that her culture deserved, then she felt comfortable teaching me about her Cuban dialect. Here's an example of a miscommunication that has recently occurred between a doctor and a patient. This month, a local radiation technician employee notices that a worker, he could be a welder or a construction worker, sets off an alarm as he attempts to enter the RCA. And he turns out to be about 28 millirem on contact. This worker had no knowledge that he had specifically received a Tech 99 metastable imaging test. And his physician told him that he should be very pleased because he accidentally received a very expensive test for free. When this worker was denied access, he used an outdoor portable restroom, and the floor of that restroom became contaminated. But not only did the floor become contaminated, but every consequential worker that used that restroom had picked up dose on the bottom of their feet. Now, if we were to just extrapolate some potential consequences of this scenario, What if this worker went home and cuddled with his wife that night and slept with her for 10 hours? Now, she has the potential to pick up 280 millirem. Or what if he took the day off to recover and he had a small infant at home and he was holding the infant on his lap while watching television? In his case, ALERA guidelines in the power plant and ALERA guidelines in the hospital don't exactly overlap very neatly. Any dose, especially something like 280 millirem, is a really big deal in the power plant, and any job exposure has to be pre-planned. But ALERA in the hospital is a little bit more lax. Patients are not required to don dosimeters, and activities, specifically restroom activities, aren't really thoroughly regulated. And there's also a differences in the way they communicate in measurements. For example, measurement units like REM and RAD are common in the power plant, whereas the nuclear medicine technicians are aliquoting their doses in becquerels and microcuries. So there is a potential for miscommunication there. But more importantly, it would be unrealistic for any healthcare professional to be able to predict every health scenario for every type of job done by thousands of different employees all over the country. And scientists and health physicists devote a tremendous amount of effort trying to find the right words that universally address health concerns. But what if our words aren't necessarily the best words? I recall the way bookkeeping is done in genomics, and I worked with hypomethylation assays that looked for trends in inflammatory protein markers upstream from gastric cancer. Then predictions about people were made based on trends from huge sample groups. So what if, through interviews, forms, and questionnaires, healthcare workers were able to have access to a patient's needs based on their age, ethnic background, and job duties that come from an anonymous database comprised of all walks of life? And here is an opportunity to involve students. Specifically, a two-year community college would be ideal for this because of the various types of curriculums under one roof that require patients or radiation protection interaction through internships and clinicals right away. And if there was some sort of stipend attached to this research, a new graduate may have the opportunity to pick up a quick job that hones their job skills while they're waiting for the real job. For example, when I graduate, a few months may pass before my internship begins in radiation protection. And I believe that if radiation safety is continuously on the tip of my tongue, that it would better prepare me for my upcoming internship. Let's revisit the same power plant worker who unknowingly picked up dose from the hospital. Now suppose he fills out a short, anonymous online questionnaire about himself. And this may consist of things like age, primary language spoken, job duties, education levels, oncological concerns, and so forth. And then that information brings up a synopsis for the healthcare worker to view prior to his treatment. Now, the healthcare worker has an opportunity to begin a dialogue that's more relevant to the patient's concerns. For example, now he or she may be able to tell the patient, "Sir, I can tell by your profile that patients who have had similar experiences to yours have expressed concern about re-entry into a power plant following a Tech 99 tests. Here is some information that you may want to be aware of." And this information can also be used to diversify signs and postings among various geographical locations, which may make them more sensitive to various ethnic cultures. For example, red has a strong connotation to religion in Latin cultures, but is also tied to celebration in Asian cultures. And the data bank would let us know if the public needs more from us in terms of signs and postings. For example, radiation is minimized with time, distance, and shielding. But perhaps someone may require more information. For example, this is how we're using our equipment to protect you, or these are the checkpoints that we're taking to avoid overexposure. And a data bank may also allow fluidity as we evolve as a country. Events like Fukushima and the utilization of proton therapy or airport x-rays will continuously cause the dialogue to morph. The effectiveness of this concept can be analyzed with a small-scale feasibility study that consists of constructing the questionnaires, data collection, interpretations, and mock trial runs. Then, if the results are favorable, the next logical step may be grant construction. And to me, it seems logical because so many people will benefit, including students and patients, to investigate this concept and kick it around a little bit and maybe see if anything's there. I'm Jennifer Bergeron from Chattanooga State College. Thank you for your time.